Great, thank you. What I have here is Jazz, and Jazz is a 10-year-old bunny and was rescued from a local shelter as a bunny who was turned in, and Jazz is available for adoption. So going over a once a month home health check. Rabbits are prey animals, and they're good at hiding their illnesses. Rabbits are an exotic animal and do require a DVM who specialize in rabbits. And if you don't know, today is World Rabbit Vet Day, so please say thank you to your rabbit vet. The once a month nose to tail home health check will allow you to know your bunny and will allow you to understand your bunny if there's any type of changes. At the end of the slides, I have a list of the terms that I may use and also links that you could do some additional searches on. As a major disclaimer, I am not a DVM. This is not to replace a visit by your DVM. The purpose of this is to uncover possible concerns that you may need your bunny to be looked at by a DVM. So the first portion we're going to go over is the nose. So what you want to do is feel the nose of your bunny, and your nose of the bunny should be dry. What you don't want to see, you do not want to feel a wet nose or hear any type of congestion. You don't want to see any discharges in the nose. And the nose should not be running. All of this could be a sign of what we call URI, upper respiratory infection. What you could do is when you examine your bunny, you could place the bunny on a couch and then you could sit on the floor. So a lot of times bunnies don't not necessarily want to be held, but if the bunny is on a couch and you're on the floor, you'll be at eye level with your bunny. And it's very easy to examine the bunny more comfortably. It's important to kind of smell the mouth or smell the bunny, and you don't want to go face to face with your bunny because they do have a blind spot right here. If you're coming in from the side, they can see you. So next is the mouth. What you should not see any teeth when the excuse me, when the mouth is closed. That'd be a sign of malocclusion. You don't want to see any missing fur or drooling. You can see from this bunny here, this bunny was examined at the shelter, and all the bunnies shown on these slides are all been looked at, they're all safe. You can see looking at the face, you may not see anything, but underneath as you get closer below the mouth, you can see that there's a problem below the chin, and that was concern about the bunny. There are also times when the bunny would be what we call a messy drinker, or may have some loose food coming from the mouth, and that drips down below the mouth under the chin. And then by looking at the bunny's chin, you can see if there's any missing fur, and then that could be looked at by your DVM. The teeth it's always important to look at your bunny's teeth. What you may have to do is you may have to move the mouth like this, or you turn the bunny a little bit upright, and then you kind of see the actual teeth. The teeth, what you want is to see the teeth to be in line, right on top of each other. Rabbits' teeth are always growing, and they need to have a constant source of hay 24/7. Also some greens, and a lot of times you could use willow. Willow toys are great. What that does is that helps grind the teeth down. There are times when the teeth are misaligned, and that's called malinclusion, and that is treatable. What the DVM would do is the DVM will actually use a little grinder and just zip on the teeth, or if it really becomes a problem, is they will have to do a teeth extraction. Because the teeth are always growing, you need to remove the lower and bottom teeth. The front teeth, you could see if there's a malinclusion. What you cannot see is if there's a malinclusion in the back molars of the mouth. They will need a doctor to use also the scope to actually probe into the bunny's mouth to see if they're misaligned. If it is misaligned, what could happen is that the bunny may not be eating hay. It may cause a pain, and that could be one reason why your bunny may not be eating hay as you would like, and that's only a DVM with the correct instruments could see that. Eyes are very important. You want to look at the eyes. What you don't want, the eyes should be free by any type of discharge or missing fur around the eyes. You may see some wetness here, which is a concern. You may see if the bunny is not opening the eyes, that's definitely a concern. If there's redness around the eyes, that's also a concern. You can see the redness and the missing fur. What could cause that is that at the very bottom of the eye here, there is a tear duct. And what could happen is that tear duct could be blocked. And that, because it's blocked down here, it causes the tears not to drain. And that creates the wetness. And that's treatable. The doctor can go ahead and clear the tear duct. My own bunny has a problem with the tear duct, so the bunny needs to go to see the vet to be cleared. And there are times also that you may need to do some massaging using a warm compress on the eye, and then gently massage the eye. That will help loosen the tear duct. The other thing is that what could happen is that your bunny may have what we call an eye ulcer, which is a scratch on the eye itself, and that causes the eye itself to be discolored, or it may also cause it to be some tears to come out. That is treatable. We want to treat that sooner than later, because what could happen if there is an infection in the eye due to the scratch, the eye can get affected, and then that could cause further harm to your bunny. And because the eye is so close to the brain, we want that to be treated as soon as possible, and very, very conservatively. Our bunny had an eye ulcer, and it took 30 days of medication to medicate to make sure the eye ulcer went away. And if you ever use eye drops, what you want to do is you never touch the top of the eye drop dispenser, because that would contaminate the medicine. Ears is another major area of concern, is that you want to look at the ears. The ears should be clean. There should be no brown spots. You should not see any brown spots. You should not see any crustation. And you also may need to have a little flashlight to look into the eye canal. I'm not talking about poking into the eye canal. I just talk about getting it, especially if the bunny is with black ears, you may need to open the eye up, the ear up, and get the flashlight in there to see if there's any what we call wax buildup. The other thing you want to smell the ears. If there's any type of infection, you would smell that. Lop ears are prone to having a buildup of earwax, and because they can't get at ears, because the ears are actually down, so it's hard for them to clean the ears. The other sign could be if your rabbit is doing any type of excessive ear cleaning with the back paw or shaking the head. That could indicate that there was a buildup of wax or some type of thing in the ears. So what the crustacean is, that's called ear mites. And if it gets out of hand, it gets pretty bad, but it is treatable with medication, and it's mainly what the medication can do. And the same thing, the ears are right here and the brain is right here. So if there's any type of infection, there's a short path to the brain. The nails are important. They should be trimmed every 6 weeks or so. Long nails can break off, they could cause bleeding, and long nails can make it very difficult for your bunny to hop. It's also could be the more often you do the nail trims is what we call this crick. The crick does not grow as long. If you do the nail trims every 8 weeks or so, what happens, the crick gets longer and longer, and it's more difficult to trim the nails. The fur is important. You want to closely examine your rabbit's fur. You could use a little flea comb. You could use the flea comb to push up the fur. What you don't want to see, you don't want to see any type of white flakes or black specks. It should push the fur up, even though Jazz is black. You could see down here, you can see more closely to the skin of the fur skin that there's any black flakes. Black flakes indicates that it may be fleas in there, or white flakes is, you also don't want to see any missing fur. So if you have a lot of white flakes, this bunny here have a lot of little white flakes all over. What that was, that turned out to be fur mites, and fur mites are treatable. If you don't want to see anything crawling or anything moving. That could be fleas or other type of parasites on your bunny. Long hair rabbit is very important to look at the fur. What could happen is the long hair fur rabbits tend to what we call get mats. That's really clumpy fur. The long hair fur, what happens is the hay gets into the fur and gets knotted, and that's called mats, and it's very, very difficult to brush out. So long hair fur rabbits do need to be brushed out almost daily, or at least brushed daily using a special comb. You need to look at them more often to see if there's any type of matting of the fur. Body, respiration, and smell. So you should, what you want to do is you don't want to hear any type of sounds. If a bunny has what we call the up URI, to be like a background sound, to be a congestion. You don't want to hear any type of congestion. You don't want to hear any type of wheezing. The other big thing is to go ahead and use 2 hands to gently fill your bunny. Both going down a parallel. The bunny, when you fill the bunny, the bunny should be symmetric. You don't want to go down on one side and you feel a bump and you don't feel a bump on the opposite side. But you should feel a bump, that could be what we call an abscess. So abscess is an infection which is growing as being covered up, or you don't want to feel any type of scabs. The scab may be an indication that something happened and it may not be treated. And what happens if there's a scab and it gets covered, there's an infection that could be growing on the inside. So the infection grows outward, inward, not outward. That's why you would feel a big bump. And if your bunny has an abscess, that's definitely treatable. But the sooner you catch anything like that, it's better. The other important thing to do is when you fill your bunny, you want to go over the backbone very gently. So this is a slide I got from Dr. Hilary Stern. When you go over the bunny, it goes gently over the backbone like this, very gently. What you don't want to is you feel the ribs, a very sharp rib, you go up, down, and if you feel the rib itself, that could be an indication that your bunny could be on the lighter side. What you want to do is you want to feel the bunny, and then you kind of like, oh, okay, there's a rib, here's a rib. That's kind of like more the ideal weight. If your bunny tends to be a little overweight, as you go over, I don't really feel anything. That's an indication that your bunny could be a little overweight. One of my bunnies is definitely underweight. And because our bunny is underweight, the bunny gets to have everything, alfalfa hay, oat hay, a lot of pellets, whatever the bunny wants, because the priority is to get the bunny more back up to the right weight. And the same thing with the ribs. The other thing is you want to gently fill your bunny like this, and then you should be able to feel some resistance going into the stomach. If your bunny feels like a football, then your bunny may have bloat, and that would be covered in the one of the rabbit emergencies. So that's why it's important every now and then just to kind of feel your bunny, to get to know your bunny. Next is a hydration test. You take some little fur off the back of the neck and just let it go down. And you should see the fur go straight down, and in the center portion, everything should just go straight down and dispense back. The reason you want to do this is that you want to do this when you know your bunny is healthy. That it gives you an idea how much that your bunny is hydrated. If your bunny is sick, if you do this, it may slowly go down. That's definitely a sign that your bunny needs hydration. It will need fluids, and your bunny should see a vet to. This will actually what happen when your bunny is sick. Your bunny could be sick because your bunny is dehydrated, and your bunny needs some fluids. So by doing this once a month, it gives you some idea of what to look for. So next is the underside of your bunny. So I have a little holding blanket like this, and then I gently move the bunny, supporting the back, and I want to examine the underside of the bunny. The bunny should be the fur should be nice and clean. You want to look, this is called the hawk. What you don't want to see is like this, any type of redness, or you don't want to see the skin. And that's an indication that your bunny may have what we call sore hocks. Soul hawks happen when they have a very, very thin layer of fur. And if they're on a hard surface, what that could do is that could remove the fur and call basically it's like a blister for like a human. It gets tenderness, it gets red. That could also cause an infection. This is all treatable by having maybe a softer padding for your bunny. Rex bunnies, because there are really short, fine hair, could be prone to that. If you have long hair bunnies, what you want to do is definitely, as you turn the bunny gently over, you want to be sure that the fur is not matted. So for long hair bunnies, the fur may be fine on the top, but you definitely want to look on the underneath fur for the bunny. The other thing you want to look for is that the private area looks clean. What could happen is that your bunny may have what we call a urine skull. That means that the bunny the urine itself is a very acid type, and that could cause problems. You will see some wetness, you will see some patchwork around the private areas because it's wet. It will go ahead, fur will actually stick to it. That should definitely be looked at. What could happen is that if you have an older bunny, a little bit less mobile, that could cause your bunny, because the bunny can't move, it will go ahead and pass the urine, and then it will actually stay in the urine because your bunny is less mobile. You may have to do a sanitary clean of that area with the help of your DVM. We'll be able to teach you. The other thing you want to look for is if there's any type of loose stool or any type of excess secretropes that could get stuck in there. That's a sign of you should have your bunny checked by the DVM. If there's any type of excess secretrope, that could be an indication of too many treats, stress, or if your bunny is older, your bunny may not be able to reach down and eat the secretropes. And at that point, what you may have to do is you may have to collect the secretrope for your bunny and help get that to your bunny. But that's, of course, you work with your DVM on that, but it is very important for you to go ahead at least once a month to inspect your bunny's bottom area. And you could use two people. One person could hold the bunny and another person could do the inspections. The next is very, very important to weigh your bunny. You could use a baby scale like this. You could use a human scale. You could put your bunny in, you could weigh a carrier first and then put the bunny in the carrier. That's another way of doing it. You could weigh yourself and then hold your bunny and step onto the scale. But the bunny's weight is very, very important. Just like people, what you don't want to see is you don't want to see your bunny losing weight over a steady period of time. Of course, if your bunny is overweight or needs to lose weight, that's different, but just your typical normal bunny, you don't want to see any type of major weight loss. The other thing is very, very important. I do have a link on how to take your bunny's temperature. The bunny's temperature is number one thing to know how to do. It's very important to do that, and you use a flex tip quick read thermometer here, along with, I use KY jelly for that. And you put that on the bunny's private part, and you go ahead and insert the thermometer. It's very important to do that at least once a month, so you know how to do it. What you don't want to do is you don't want to be, if your bunny is sick, number one thing is to take the temperature, and then you forget how to do it, or you lose the thermometer. But so what happens is and it's also important to know your bunny's normal temperature range. Ours tends to run a little bit lower, around 101. Some bunnies tend to run a little bit higher. It's based on your bunny's body, and also maybe how far you insert the temperature thermometer. And then at the very end, of course, you give a bunny a treat. Next is bunny warning signs. The bunny warning signs. This is a bunny 911. This is, of course, is a stuffed bunny. But what you may see is your bunny is really just lethargic, and your bunny's head is up. That means your bunny is really gasping for breath, and this is assuming that your bunny is not active. Something's wrong with the bunny, and you're seeing that the head is basically up, or it's on an object trying to gasp for breath. That is a 911. You need to call a vet immediately. The other one is that you see your bunny is not acting normal, and then your bunny is in pain. So what happens when a bunny is in pain, just like people, you bring your arms and limbs near you. So the bunny will bring the arms close, the legs close to the body, and you hear a grinding sound of the teeth. That means your bunny is in pain. The other one is that your bunny is really limp. It's just kind of flopped onto the side. You kind of lift your bunny, and your bunny is it's like a rag doll. Your bunny is crashing. So in all these cases, this is a bunny 911. Prior to this, you need to know, if I ask you right now, will you take your bunny vet? You should be able to list immediately. I would take my bunny to this location. If you don't know, if you cannot answer that question, go to your local rabbit rescue group, look for your area, and then look. They should have a bunny 911 list. The other one is to look at the HRS website, rabbit.org, for a list of the rabbit vets in your area. The other one is to look at this one here, as your bunny is choking. There are signs where your bunny has eaten something or something happened and your bunny is choking. You have no time whatsoever to go to a vet. You may need to do the bunny Heimlich method, and they have a link here. Choking your bunny could die within a minute. I was feeding my own foster kit, and something happened during the process of feeding the kit, and the kit was choking, and I had to use the bunny Heimlich maneuver. If you not do that, the bunny would have died. You have zero time. You need to react. So today, if you cannot answer where you take the bunny to, look at your group, look at the rabbit.org, write it down. Look at the video of the choke, if your bunny is choking, how to do the bunny Heimlich maneuver. The other thing what happens is that your bunny know your bunny. Your bunny is either active in the morning or is usually active at the end of the day. If your bunny is not acting normally, your bunny will come up to you in the morning. Oh, where are my treats? Where are my greens? Where's my hay? Where's this? And your bunny is sitting there. Something is not right. It may be the start of Gaistasis, and this is a bunny 911. If your bunny is in stasis, your bunny could pass away within a day. The other sign is that your bunny is very lethargic. It's grinding its teeth. It's in a hunch position. This is why I mentioned before, you should feel your bunny is, if the bunny should do this, and your bunny feels like a football, your bunny may have bloat. Bloat is a buildup of gas in the stomach, and now your bunny could pass away within hours. The other thing you could do is you could look, see if your bunny would eat any treats. So your bunny is not behaving normally, I would go ahead and give some treats. Maybe just had a bad day, you give it some treats. It's, oh, okay, that's good. But the number one thing to do if you feel your bunny is not well is to take the temperature. Remember that the bunny's normal temperature is 101 to 103. If it's outside of that range, this is a bunny 911. So now you determine that there's a problem with your bunny. You must remember you are speaking for your bunny. When you call your vet, they will ask you a question. Is this an emergency? The answer is yes, this is a bunny 911. It is also very important to be exact as possible as to the nature of your call. You say, this is a bunny 911. My bunny is in possible stasis. My bunny has not eaten or act normally since X. My bunny is in pain. The other thing you have to say is, do you have a rabbit vet that I could see? If you do not, do you know of a place where I could take my bunny? So going back to the call, my bunny is in GI stasis. My bunny is very lethargic, it's not eaten, or my bunny's temperature is 100 degrees, 99 degrees, 80, 98 degrees. You can say my bunny is in pain. I could hear the teeth grinding. My bunny is having a difficult time breathing. You need to be very forceful. When you say this is a bunny 911, that raises the urgency of the call. And it should state the reason in a calm, deliberate manner that the person can understand. They understand you know what you're talking about. That would try the best they can to get you to and to see a vet. So there's a basic home care test, a home care kit that you should have. I like to have an electric heating pad, and that could be turned on 24/7, or it could be turned on, 1 or 2 hours. It's important to have a flex tip thermometer and know how to use it. It's important to have some critical care and the syringe for it. You also have to understand that when I see a lot of times where people will say my bunny is sick, give the bunny critical care. Critical care can only be absorbed by your bunny if your bunny's temperature is 100 degrees Fahrenheit and above. If it's below that, your bunny cannot absorb it. If your bunny has bloat, if you feel the bunny is like a football, your bunny has gas, anything going in is going to make that situation worse. So remember, if your bunny is tight as a football, is not behaving normally, your bunny has possibly have bloat, and you have hours now to go to the vet. If your bunny has bloat, what they would do to give your bunny some medication, and then they will insert a tube into the stomach going through the throat. I did see on my DVN do that. And then what will happen is, because of the gas buildup, as the tube is going inside, everything gets pushed out because you have a tube, and then everything came out of the bunny. That's called decompression, I think it was. So remember, rabbits cannot throw up. That's why if you're having buildup of gas or anything like that, that's very, very life-threatening for the bunny. These are several reference books that you could use. Definitely read the article on Gaistasis. This is a well-written article about that. These are three books, well-known books that you could get. Amazon will have it. This is a good video on how to take your bunny's temperature. The only thing that they did not say is that you should use a flex tip thermometer and a quick read thermometer. These are links that you could use. You could do a search on wet nose or eyes, and this gives you more information on the more terminology. What that means and what to look for. Teeth malocclusion is treatable, but it could be expensive, and this goes a lot into on the treatment for malocclusion. Ear mites does happen, and that's very, very treatable. Dr. Hilary Stern wrote a good article on external parasites in rabbits. This goes a lot about wet noses, wet eyes, or teeth malocclusion. This is an article on what we call sore hawks. This is an article on rabbit dehydration, what it looks like. Urine scalding. This is the awkward search for abscesses. That's it. I think I hit the end.
Well, alrighty. Thank you so much, Ray, for the very useful information on rabbit warning signs. I feel like some of these are absolutely necessary to know when you own a rabbit or if you're considering owning a rabbit. So that way, you know, you're doing your best to take care of the rabbit and or making sure that you're not putting any or causing them any harm unintentionally. And yeah, I would love to open up the floor right now for any questions. I'll go ahead and leave it open for like about a couple of minutes. For any questions that anybody might have or any last comments you might have, Ray. I like your friend that you have in your lap, by the way.
Very adoptable.
Yeah.
Let Marcy know.
I've seen.
It's very emphasized with Marcy. It's very important that everybody needs fosters. Fosters is a good way to help the rabbit community.
And can they find the foster information on your website?
Yes, go to SaveABunny.org, you see it. So some of the ways to clean your ears is definitely, you know, work with the DVM, but it's very, very straightforward. There's a solution you could do. You could put it into the back of the ear, and then you gently massage your bunny, and then the bunny will shake it off, and they could use either a Q-tip or a cotton ball to go in there to get it out. Because it's dealing with the ear, you definitely want to have your DVM show you how to do it, but it's very, very straightforward because you're dealing with the ear canal, and the bunny also has a false ear passage. So you have to know which one to go into, and it's best to work with your DVM on that, but it's very, very straightforward. Okay. So in terms of the thermometer, when we talked about, you put the thermometer in the anus. Just wanted to clarify that. So there's a problem in a litter box. If a box litter starts having accidents, that inactivity or spit health issue. So when your bunny has accidents from the litter box, that could be a sign that you have to see if your bunny can hop in, hop out. It could be a mobility issue. If your bunny may have difficulty hopping into the box. Older bunnies do tend to slow down, and they may have a little bit more difficulty getting into the litter box. If that's the case, you can always try a low profile litter box. At one point, we went down we had an older bunny, 15, and what we had to use, we actually use a cookie sheet, just something to put the litter on is what we had to do. The typical litter box, as a cat litter box, is like, a couple inches tall. You could get some really low profile ones, or just go to the Target or something like that. You see various type of, it could be either a lid to a plastic box, just something in there to, you just want to hold a plastic and just some litter on there. So in terms of its owners, whether a bunny has obstruction or just stasis, you have to remember stasis is a sign that there's an underlying problem. So GI stasis is a basic term for that. Your bunny cannot pass, they have a block, they cannot pass to poop or go pee. There could be a blockage. Your bunny may have an infection, and the only way to determine the cause of the GICs is to go through a vet. Your vet typically would do blood work to see, the blood work would indicate any type of underlying medical condition. X-rays are good. The X-rays will show that if there's a lot of gas buildup, that could be an indication of a blockage. Your bunny would do a physical exam with their hands on the bunny's stomach to see if there's something, a block or any type of obstruction in there. But definitely you need to see a DVM for that. There's a question on tear ducts. So yes, my bunny has pretty much a blocked tear duct. So typically, I always talk to Dr. Stern on a tear duct. The tear duct is not designed correctly. The tear duct is kind of a little corkscrew. It's not a straight line going out. So because of the corkscrew, the tear duct got blocked, and it was really hard for them to drain it. So what I have to do now pretty much is once a week or weekly is to do a compress and just kind of massage the eye, and that'll help force the tears out, or hopefully in time remove the blockage of the tear duct. The bunny's name is Jazz, and Jazz is adoptable.
He's such a good boy.
Any more questions?
Well, alrighty. Well, then, speaking of Jazz, we can go ahead and jump right into your guys' SaveABunny adoptable rabbits that you all have ready. Thank you so much again, Ray, for everything that you presented. That was some wonderful array of information. And it looks like actually you had one more question here. Theresa would like to know, her bunny lived outside all his life, and she's wondering if you can foster bunnies outside.
For SaveABunny, all the SaveABunny bunnies are fostered inside, especially around the Bay Area. There's a lot of dangers in the Bay Area. Mixed mitosis is all over the area, and RHD-V2 is in the Bay Area. So for the health and safety of the bunnies are held indoors all the time.
All right. Thank you so much again, Ray.
Okay. All right, I wasn't